Coast. He's taken over, and we've done a number of these sites for seniors. It's been very, very effective. So we really want to thank. I also want to recognize Sheriff Nacco for being here and being a good friend. So today, as you see, we got a number of seniors in line. We're going to do a senior pod here in Pasco County. There's going to be 3,300 Pfizer shots over the next 3 days, 1,100 vaccines a day for seniors 65 and up. And these are folks that were rostered by the CDR McGuire Health waiting list. So we appreciate their work on that. We're also today, and Andy also set this up, there's another one of these exact same setup, 3,300 Pfizer over the next 3 days in Polk County at the Four Lakes Mobile Home Park. And so we have seniors there in Polk to be able to get the shots just like they're doing here in Pasco County. It's really good. We also are happy to be able to announce that we've been working with Walgreens. You know, we have some retail pharmacies, Publix, some of these others. We're working with Walgreens to be able to bring some vaccine to Pasco County at Walgreens. So they've agreed to start with 2 Walgreens in Pasco. The first pharmacy location is 12028 Majestic Boulevard in Hudson, and the other is 6429 Gall Boulevard in Zephyrhills. So beginning tomorrow on Thursday, you go to walgreens.com and you click COVID vaccine information, you'll be able to schedule an appointment. And the first shots will take place at Walgreens on Friday. And they think that they're going to be able to do 80 appointments on weekdays and 60 appointments on weekends. And so, you know, that's really good to have two additional options here in Pasco County. And that obviously is adding to what's already here. We have 19 Publix pharmacies throughout Pasco County that are offering seniors vaccines, 3 Walmart pharmacies that are offering vaccines, and 1 Winn-Dixie that's offering vaccines. So if you want to sign up for those, Publix.com/COVID vaccine. They opened up another window this morning. The next window will open up Friday morning. And what they've been telling me, and this is good, you know, we've vaccinated millions of seniors in this state already. It's easier to get online now because, you know, we had millions of people trying to get these spots. Well, now you have millions of folks that have already gotten appointments and gotten shots. So it's not like if you're not on in 3 minutes that they're all taken now, which is good. So I would just let people know if you've had trouble doing that, if you haven't gotten it, it's probably going to be a little bit easier now. Walmart website, walmart.com/COVID vaccine. Same thing with them. It's a little bit easier than it was in those initial days when we first rolled out the retail stuff. And then Winn-Dixie is windixie.com/pharmacy/COVID-vaccine. So one of the reasons we're doing Pasco is because we've done a majority of our seniors in Florida. We've done millions of seniors because we put seniors first. If you look at all the metrics, we're one of the top in the country for vaccinating seniors. But in Pasco, we're 42% of seniors. So we want to get it over 50% very quickly. So this, combined with an additional retail footprint, we think we could do. But you look around the state, St. Johns County, 80% of seniors have been vaccinated. Leon County up in Tallahassee, 75% of seniors have been vaccinated. Duval, a million people in that county, 60% of seniors. Broward, almost 2 million people, 60% of seniors. Palm Beach, 1.5 million folks, 25% are seniors. We've done 61% of the seniors have gotten shots in Palm Beach. And so that's really good. 42%, honestly, nationwide is probably better than average for seniors, but we want to be able to do more. And so I think this will help. We've done it in Sarasota, some of these other counties, and now you're starting to see them up at 50%. And Pinellas is going to be at 50% probably tomorrow based on the numbers that are being reported. So we think that this is exciting. We're also continuing to do other sites throughout the state. I was at Edwin Waters College in Jacksonville. We're working with HBCUs. We're working with some other areas. We also have done over 65 faith-based sites across 18 counties. We're going to do more this weekend, tens of thousands of vaccinations there. And here in Pasco, we've had 2 sites that are permanent that the state's been supporting, St. Leo University and Gulf Square Mall. Those offer about 3,500 shots a week each, which is really, really good. our senior 55 and up, which really this is part of that. You know, we've done a lot of communities, we've done a lot of folks. It's been very, very successful, and we're continuing to do homebound seniors. Today is the start of 4 sites that are going to be run by FEMA. One of them is in Hillsborough County. We also have Miami, Orlando, and Jacksonville. So they're open this morning. Each one's going to offer 3,000 vaccines a day. The people are being rostered by FEMA, so that's not necessarily the state. I mean, we're helping when we're asked, but it's a federally driven thing. But they're going to have, that's 12,000 doses a day in addition to what we were already getting. So we didn't divert any vaccine to these sites. The federal government brought additional vaccine, and so we're happy to be able to have those put to use. We also did the executive order on Monday, as I had said we were going to do. We're going to be able to do age 50 and up, police, fire, first responders, and teachers and school personnel. And the way we were looking at it is the Johnson & Johnson we knew was going to be approved this weekend. It did get the EUA. We're scheduled to get 175,000 doses of the Johnson & Johnson vaccine. That's a great vaccine because it's one dose. You don't have to come back for a booster, and it was 100% effective at preventing death and serious hospitalization in the clinical trials. So 175,000, that actually is enough for us to do all law enforcement, all fire, all school, age 50 and up in the entire state. And so we think that we can put it to use for there. So I've talked with Sheriff Naco, I've talked with some other sheriffs and some other of these pretty big counties about partnering with them, and hopefully we'll have an announcement soon. We'd like to partner with these, with the sheriffs, with the police, with the school districts, and then offer pods with the Johnson & Johnson vaccine for these folks in that 50 and up category that are teachers or bus drivers or cops or sheriff's deputies. I think we can get through a lot of these people very quickly. So Miami, Tampa, Orange, and Duval have those federal sites. So if we're going to be doing these pods, we're going to look at places like Pasco, we'll look at Pinellas, Lee, Broward, some of those places, and be able to do it. I think we can get thousands and thousands of people through each of these sites very quickly. So we're going to be working on that over the next couple of days. We don't know for sure when the J&J vaccine is actually going to come. We're hoping by the end of the week, but we do know that we're scheduled to get 175,000 doses. And then as we go beyond that, hopefully we'll be getting a similar amount or more on a weekly basis. And so that's really good news. I think a lot of people will be really excited to be able to get it. You know, we've had some people contact our office say, hey, our folks want Johnson & Johnson, which is good. So there's demand for it. And I think that particularly if you're doing something like running a sheriff's department, to be able to get some of your folks 50 and up with one dose and not have to worry about coming back for a booster, I think that's really, really good for folks that are in the workforce. And so the police, fire, and the education will kind of be our 50 plus, and we're going to try to dedicate the Johnson & Johnson to that mission. And hopefully we're able to pick up a lot of ground on that. So thanks everybody. Thanks Wilton for working with us to identify what would make the most sense in Pasco. We were in Hernando last week. It's a phenomenal site. We did thousands of doses there over a few-day period, and we're keeping up the momentum here in Pasco.
Thank you, Governor. And I just want to thank the Governor for coming to Pasco today. You know, these things don't happen by accident. The notion that Florida has remained open and been able to remain open shortly after the pandemic started is the leadership of this governor. And under this governor's leadership, we hope to have, I believe we will have shots in every arm by the end of March to our 65 and older, our most vulnerable population. Anybody who wants it will have it. The notion that now we can start covering 50 and up and bringing in our law enforcement and other professionals is a tribute to the coordination that this governor's office has done in the state of Florida. And Governor, we're very pleased to have you here this morning in Pasco County and Zephyrhills. And we look forward to getting our numbers up above 60% here in the next couple of weeks. So thank you for being here. And I look forward to seeing you tomorrow, probably in Citrus.
Yeah.
Sheriff?
I want to thank the governor and Senator Simpson. You know, God puts the right person in the right place at the right time. And I can imagine when the governor ran and when President Simpson ran for their offices, they never expected this to happen during their tenure, but you know, it did. And their leadership is leading us through. You know, not only the fact that Florida is leading the way in getting people inoculated, The fact that when you go around Pasco County or anywhere in the state of Florida, the governor doesn't always hear this, the president doesn't always hear this, but I'll hear this from our small business owners. They're very thankful. They're thankful that the epidemic, did not take away their businesses. It's horrific that anybody would die or lose their life, but for people to lose their businesses also, it's devastating. So I want to thank the governor for his leadership on that, the president for his leadership on that, because we're not facing the same issues that unfortunately the rest of our country we see out there them facing. The other aspect that our law enforcement are going to be able to get, the Johnson & Johnson shot, that is tremendous for firefighters, first responders, the deputies, not only on the road but in the jail. That is very critical because, not only does it affect the member that is doing the job, but it affects our family. And we're put in worst case situations. And, when somebody calls 911, we can't decide if we're going to go or not go because if they have COVID or not. We will respond to the worst case scenarios no matter what the person is sick with. So we're putting ourselves in bad situations. This shot is going to do something to help our members to be safer when they go out there. And the last thing I want to leave you with is, you talk about being on the forefront of issues. Governor DeSantis and his wife, Casey, have been leaders on mental health and substance abuse issues. I would tell you, the issues that we see within Pasco County, I can imagine throughout the rest of our state and the rest of our country, there is a healthcare issue happening right now. There are people dying because of COVID, but the mental health issues related to COVID are going to go on far beyond, getting people the vaccination. These mental health issues where people are committing suicide, young kids are cutting themselves because of social issues going on, these are issues that are going to live with us for a long time and we will address them. I'm very proud that we have a governor and a first lady that even before the epidemic hit us of COVID, they were addressing these issues, and their foresight, their ability to say and recognize mental health as a critical issue will help Florida even more as we face the mental health issues associated with COVID. So again, President, Mr. Governor, thank you very much.
And you look at all these issues, just think how much worse they are in these states that have locked kids out of school for a year. Just think how much worse it is in these states that have 50% higher unemployment than the state of Florida. Just think how bad it is for places where you don't give people the freedom to be able to live their lives. And so you can't treat people that way and think that there's not going to be major problems. And so I think Florida, we obviously have done a lot focusing on seniors. If you look at the senior population around the country, 40 states have higher COVID mortality amongst seniors per capita than the state of Florida because we tried to focus on seniors, our nursing homes, our elderly. And so it can be done. But what I see around the country is I see some of these states have destroyed a lot of families, a lot of students' ability to prosper and thrive. And now what they're doing in Washington is saying, if you've done a poor job, we're going to give you even more money. And we're going to take money away from Florida and other states that have done a better job. How is that fair? Fact of the matter is, if you're going to send money to states, you send it on a population basis. And if anything, we should get more because we have more senior citizens than almost anybody else. And so for them to be benefiting the states that have chronic unemployment, bad pensions, and have way higher, you look at like the New Yorks and the Illinois and the Michigans, they have higher COVID mortality per capita in Florida, and they have younger populations. They have worse unemployment, and they've locked a lot of these kids out of school for a year. So I hope when the Senate gets this bill that they change that, because that is fundamentally unfair to be penalizing Florida because we have people working and people are happier and the kids are in school, and then to reward the folks who haven't been willing to make the right decisions. We need to get this thing straightened out. We're not asking for anything special. We just want to be treated fairly, and that's all we're asking for. With that, I'll take a couple questions. So basically, it's really a doctor's decision. Because we wanted to get away from this of like, we're saying you count. So we've had the comorbidities in from the very beginning with hospitals. We said the very initial in December, hospitals, because the hospitals got a lot of vaccine, they can vaccinate anyone who a doctor deems to be especially vulnerable to COVID due to underlying health conditions. Now what we've done is say, okay, maybe you're not going to a hospital, maybe you just go to your doctor. The doctor can do that, can vouch for it, and then you can go and get a shot at some of these things. But we're really putting that in the hands of the medical doctors rather than us arbitrarily picking and choosing, because the fact of the matter is, if we pick certain things, we may leave some out. We could include things that may not. So we think we're trusting our doctors is the way to go. I think most of the physicians, they have to sign their name to this. They obviously want this to be something that is that is legitimate. So I don't think you're going to see any funny business with it. But I think it's more about trusting them. They've seen how this virus has impacted different folks. They can take a look and they can make that determination based on those underlying conditions. Well, obviously, that would be a fraud, and if that happens, and of course you'd be held accountable. But I don't think the physicians are going to be engaged in that because for a couple reasons. One, they don't want their medical license at stake. But two, yeah, but you have to have, it's got to have the medical professional on there. So I don't think you'd really be able to get away with that. But here's the thing. Particularly with the physicians, we're going to be starting to send more vaccine to practitioners. We've sent some, but we're going to get, with Johnson & Johnson continues to come in, this should just be in every doctor's office. And then this way they're able to go and work with their patients. And so if physicians are somehow not following directives now, well, then that would not be something we'd have confidence in. We obviously want folks to just follow the rules and do it right. And I think they are going to do it right. I think it'll be good. But I just think it is important to point out, comorbidities is not anything new in terms of vaccine. We've been doing this the whole time. We put the onus on the hospitals because they have the doctors and they had a lot of the vaccine, so it made the most sense. Now that there's more vaccine available, now that you're seeing more physicians have it, but then also people go to their doctors, we thought it made sense to be able to take this next step. Have you looked at the figures in a place like Gadsden County, for example? Have you? I know, but I'm just saying, like Gadsden, that'd be a good example of the state's effort. Have you looked at those figures? Okay, so here's the thing. So Gadsden County is the most heavily African-American county in the state of Florida. They have 60% of their seniors have been vaccinated. That's higher than the state average by a significant margin. And we've worked closely with folks. We've also brought vaccine because it's not just the fact of like, you're in. Some people say, if you're in CVS, they're not in the right neighborhoods, whatever. No, I don't think that's the big a deal. I think the issue is people want to have trust in the vaccines. And so that's why we've worked with so many churches and houses of worship. Because if I have a pastor of like an African-American church taking it and telling folks this is good, you then get more buy-in. I've talked to some folks, actually we've gotten some for some of the African-American churches, they want the Johnson & Johnson. They think that that's better. So we've worked really hard to get it in those areas, and I think the FEMA sites that the federal government's doing, that's going to be kind of their main, one of the main things they're trying to make sure, find different areas that are underserved. As I noted, when we were at Edward Waters College, we announced a number of sites in areas that are underserved. I started in Pahokee weeks ago. We did Pahokee. We liked what was going on, so we made that permanent. I actually think we've probably exhausted that. Probably move it to Belglade or somewhere that needs it. And then you have all these places in Dade and Broward and some of the other places. So we're going to continue to keep doing it. But you do need, I think, to have some folks who are trustworthy in the community, who stand up and say, this is something that's good, and there is some resistance on that demand side. That's just the reality. So the more authority figures and trustworthy people you have there, I think that the more folks will want to do it. So the J&J is 175,000. We think we're going to get it by the end of the week. We don't know for sure. Then what you have now is the Moderna from 2 weeks ago was delayed because of the ice storms. So that Moderna has hit, so that's being used, and then this week's Moderna. So I think you're going to see definitely more doses than last week, because last week you had folks that didn't, that's 200,000 doses that we didn't have that we would have done. We also have more footprint now. Every Publix pharmacy is now offering vaccine. We're seeing the expansion. Walgreens is coming online. You're seeing we expanded CVS in Miami-Dade. That's an interesting case study. Palm Beach and Miami-Dade are great case studies in how retail pharmacies really can be game changers. Palm Beach was probably below the average. We put Publix in 65 pharmacies in Palm Beach. 90% of the seniors live within a mile and a half of at least one Publix in that county. And then they went way above the state average. Now they're 61%. Miami-Dade, just like a week ago, was in the, I think, the low 40s. We put 67 CVSs in last week. Navarro Pharmacy and CVS EMOS, they're all under the same umbrella. Dade is now 52 or 53%, just like that, because in each store, they can do 50 or 100 shots in each store. So you take 67 stores, that really makes an impact. And so those doses are coming from the federal pharmacy program. And I think that's a huge game changer. We have always been working with pharmacies with our doses, but all those other pharmacies, that's all in addition to what the state's getting. So I think this is going to be a really good week. And I think these types of events, what Andy's been able to do. So we were in Manatee on Monday or Tuesday. Started Tuesday or Monday? Tuesday. So we did a mobile home park in Manatee. So that's 3 days, 3,000 shots. We're here in Pasco, 3,300 shots. Polk is 3,300 starting today. We're going to be doing more in other parts of the state over the next few days. So that's going to increase these numbers very well. We need to get every county, we need to be over 50% of seniors. That just got to happen. And so we're on our way to do it now. If you look now, the laggards in coverage for seniors are mostly rural counties. And some of that is, some of it we need to surge some more stuff, but some of it is hesitancy. So we've got to work on both of those fronts. But the good thing about a rural county, if you get a good setup, you can go from 30% to 50 or 60% overnight. So we're going to be working on doing that, and I think it's going to be really, really good. So the bottom line, I think this is going to be our best week yet in terms of the number of doses, not just first doses, but of course we are still doing a lot of second doses. Good thing about J&J is once we do these, see Andy, when they do these sites, they've got to then say we're going to be back in 21 days, which is fine. We're happy to do it. But with J&J, you do a J&J site, you do one, you go to the next, you go to the next. You don't have to worry about doing that second dose. So I think that's really exciting, and I think hopefully we'll be able to work with Sheriff Naco, some of the other sheriffs, and have some good announcements about how we're going to apply the J&J. But the important thing, one of the reasons we did the 50 plus, because we knew with J&J, that in of itself was enough to take care of the 50 plus police, fire, and school. So the seniors, we're still seniors first. Nothing that we've been getting changes that at all. So that's still the top priority. But I think we smartly supplemented that with some of our key personnel because, as the sheriff said, they're in contact with a lot of people too. And we want to make sure that we're offering them whatever we can do to be supportive. So, all right, well, we're going to be back in this area very soon, and we're going to keep going until every senior that gets a shot, that wants a shot, gets one. Yep. So the question about daycare workers, yeah, I'm supportive of that. We may have to change the order, but I think that would be totally reasonable to include them. So, all right, thanks, guys.